fitness enthusiasts and ultimate Frisbee aficionados to the Tobu Fitness Podcast. Your guide to elevating your game and mastering the art of ultimate Frisbee through the lens of strength and conditioning. Whether you're a seasoned player or just stepping onto the field for the first time, this podcast is your one-stop destination for unlocking your true potential. This is the Tobu Fitness Podcast with your host, certified strength and conditioning coach, Justin Shelby.
What's going on, everybody? Welcome back to the podcast. This is episode number 8, the Tobu Fitness Podcast. Today, if you're watching on the video, you can see we're in a bit of a different location. Still in Austin, but a little bit on the outskirts. I've come to an old coworker, good friend, office. This is Dr. Matt Centofonti. Dr. Matt, how are you?
Well, buddy, thanks for coming out.
Thanks for hosting me. Thanks for being on the show.
Absolutely.
Do you want to tell everybody a little bit about your background?
Sure, yeah. So, as you said, Dr. Matt Centofonti, so chiropractor, specifically treating to the sports population. Background is more from a baseball perspective. So I went to college and played baseball down in San Antonio at the University of Incarnate Word. Originally from New York, played high school here in Round Rock, which was a pretty big powerhouse, and then went down to San Antonio for my college years. Coincidentally enough, and this is kind of the long-winded answer, I actually fractured L5 vertebra my freshman year of college. I was a walk-on. I became our starting third baseman and ended up fracturing my L5 vertebra about, March, so which was about halfway through the season. Didn't know it. Played on it for about a month, and then it came to a point where I couldn't even do a thing. I could barely walk. I could barely swing. My coach yelled at me. I finally had to confess that my back had been bothering me for a month because I was 0 for the month of April. But played baseball throughout all 4 years, and then decided to go into the corporate America world in Dallas. Did that for 13 years, specifically digital marketing. And then, told myself when I was in the jungles of Costa Rica that, something bigger, something more was out there for me to do. Thought about becoming an orthopedic surgeon. My next thought and thing that I told myself was you weren't smart enough and you didn't have the time to do it. I was deathly afraid of gross anatomy and having the thought of being in the cadaver lab. And that's what really pushed me away from even exploring medical school. Met a couple friends along the way that were actually chiropractors, sports chiropractors in Dallas, notably Dr. Logan Sherman at Sherman Sport and Spine, who has become a really good friend and a mentor of mine through the process. And then I decided to go into chiropractic realm, specifically treating with active release techniques, soft tissue therapy, just because it helped me so much in my disciplines of endurance athletes or athletics and specifically cycling. So I decided to go back to school when I was 34. So it's the ripe age of 34. Had to go take a couple of prereqs, went to Parker University. And I'll tell you right now, my favorite thing about that entire curriculum was the cadaver lab. The first time we dissected and we went into it, I fell in love with it just for the fact of understanding the intricacies of the body, the mystique around the architecture of the anatomy. Graduated in 2020, moved back down to Austin because of our family. Had a little stint up in North Austin where Justin and I actually met each other, which was awesome. We gravitated one another immediately and loved just bouncing ideas off of each other and just talking about presentations of athletes or patients and thinking of things, how can we approach these stuff? So it was just very organic in nature that we could have that type of relationship. And then, things in life changed. And then my wife and I decided to move out here to West Austin, which is where we are, Spicewood area. And then just opened up my own practice. It is now month 2. So here we are at Kinetix Sport and Spine in month 2.
And congrats on opening up the new place.
Yeah, man. Thanks.
So for me, right, starting the Instagram and everything, and I do a weekly Q&A, and I put out a lot of stuff. I feel like I answer a lot of questions, and I feel like a lot of that is just because I don't have that environment of being around other people now to have those conversations with, so I just have to kind of project that in a different way.
Yeah.
But yeah, like for people that don't know, like when you're surrounded by other people that have the same like interest in exercise and just the science and the theory and stuff, like it's so fun to just bounce ideas off of each other because that's where the most amount of learning and stuff comes from. But yeah, I feel like from what you said, we've got a lot to unpack there. So one of the reasons I wanted to bring on Dr. Matt was just because of your understanding of the spine, your understanding of rotational sports. Right, when we talk about ultimate, there's the throwing aspect of it, which I think is really huge. And I think, of course, with ultimate, the way that we throw is different. But at the end of the day, rotational throwing is, there's foundational principles across everything. In golf, there's big rotation thing. In baseball, there's a big rotation thing. So I think there's a lot that we can talk about. But I guess we've got to start off with chiropractors. When people hear chiropractors, there's a big misunderstanding, I think, a lot of times. I think it comes from a place of maybe people had bad experiences, maybe the beginning of the field wasn't that great, but I think there's also a lot of great chiropractors now who are doing a lot of great things. So do you want to kind of talk about maybe where that myth of chiropractic comes from?
Yeah, we can unpack that all the way back into the history and understanding where chiropractic originated, how it evolved, and then how the medical industry really worked and put lawsuits out there to destroy the profession, which, in 1980s or whatever, the lawsuit was won by chiropractors as it relates to the defamation lawsuit, etc. You have different camps, just like you will in anything, any profession. So I'm not just saying that this is specific to chiropractic, because you're going to find, lawyers that are not the best ethics. You're going to find marketers that are deceiving. You're going to find, insert profession here and have some of those things. But how people approach the body and the body is, let me just say that it's a very dynamic thing, right? But you're going to have people that are a little bit more on the abstract side and then the concrete side, right? So people that have the notion of these components will affect other things by association, and they're fully rooted on the term subluxation, which subluxation is the root of dis-ease with a hyphen, not disease, dis-ease, which is a component of the body which is not operating properly, or it's impinging upon the nervous system, which is then affecting the body, et cetera, et cetera. That's fine. On my side, in this, where I stand is more mechanical in perspective. I don't see it as quote unquote subluxation, simply because of the root of that word is more about a dislocation of a bone or a joint. That's not what we're dealing with. We're dealing with dysfunction. Okay, we're dealing with dysfunction in a joint. We're dealing with dysfunction in muscle contractions. And that is the side to where, a lot of the sports chiropractors kind of sit on, is understanding the mechanical process of the body and how it works through certain actions. You're going to find, people that just are strict adjusters that'll only adjust one segment of the body, one vertebra of the body, and here's the thing, like if it works for you, it's great. Right. I'm not trying to knock, like everybody has their thing and that's awesome. But from a sports perspective and understanding how athletes use their body and have to put themselves in a dynamic position or situation to achieve that task, we have to look at the whole picture. We've got to understand what ground force reaction is. How are we doing with our foot plant? Where are we rotating through the hips? Do we have enough internal rotation? Do we have enough good stabilization in the core to then translate that into, let's say, a throwing motion, right? So, again, like with sports chiropractic, like we take a look at the entire system. We go through the musculature. We understand movement patterns. We understand compensatory patterns of where our body will naturally lean upon, whether it's to avoid an injury or because there is an injury rooted in that. So you've kind of created like this development, and then we're doing adjustments simply to remove dysfunction, to where we can regroove the movement pattern for that athlete and their task.
And for those that don't know, adjustments are just like the cracks, the common stuff that you'll see.
Yeah, and that's, a lot of people will associate a pop or a crack with that adjustment. Doesn't necessarily means that the joint has released. You can still get motion through that without a loud audible crack. But yes, a chiropractic adjustment is when you are creating a force through a joint to regain mobility.
And from what I understand, you use that as a tool in your overall process. Like,
Yes,
yeah.
a single tool. Yes,
Yeah.
it is one tool.
Yeah. Whereas I think a lot of the misconceptions about chiropractors come from chiropractors that kind of use that as like their only thing, and they're like, oh, you have kidney dysfunction, let me crack your spine.
Yeah, and look, there is no research that can definitively state such. So I don't want to get too far into that side of things, but until the research, can definitively prove that, like, we're basing ourselves off a theory, and that there is no definitive measure that is actually going to result in that type of illness and coming
Yeah.
out of that illness.
Yeah, but yeah, I think it's good. It's a, like you're saying, it's a single tool you use to look at the body, at like the whole picture, kind of all the movement, which is, I think, super, super important. I mean, I'm pretty sure for the listeners, if anybody that listens has been to a chiropractor, they've probably never talks about ground reaction force.
Yeah, right.
and
Yeah,
hip
there's a
mechanics.
few of them out there, and those are the ones that I really tend to follow, just because of, one, notoriety, two, who they're working with, right? And the proof's kind of in the pudding as it relates to athletic performance.
For sure. So what are like your bread and butter, I guess? Like who are the athletes or the population that you feel like you work the best with?
Yeah, good question. It's kind of interesting, right? Because, like, when you look at populations, sometimes you are dealt the hand that you're not expecting, but you kind of go into it, right? When I was in college, it was like, okay, look, I'm gonna work with rotational athletes. I'm gonna work with baseball players. I would love to get into golf, and build it off of that, right? When you get into practice, that's not necessarily the case, right? Like, endurance athletes, runners, CrossFit community is huge, right? So understanding that discipline. But I would say, like, from a specialty perspective, it's still kind of into the throwing athlete, and really gravitating myself back to the rotational athlete, golf, baseball.
And what are some of, if you had to list a couple, like what are some of the big kind of common dysfunctions or injuries that you see in throwing athletes?
Throwing athletes, you're gonna see a lot of impingement cases. You're gonna see a lot of anterior shoulder impingement cases. Okay, rotator cuff strains are also going to be very prevalent, and then low back. Low back is going to be a big thing in those profiles.
I guess starting with the shoulder then. So like with impingement, I know myself personally, like when I first started playing Ultimate, especially when I throw a backhand, so not your forehand this way, but rotating through and backhand, my shoulder would hurt like crazy when starting. And I know a lot of people kind of probably have similar issues. A very common thing that you'll hear in Ultimate, I know it's the same in most throwing sports, but it's like you want to use your leg, like your legs are where you get your power, right? Your shoulder and your wrist are really just kind of what guide it, but your power comes to the lower body. But that's easier said than done. It's like when people say get low, it's like, all right, how?
Right.
How do I use my legs and my core and all that to get the power? Like, I guess, could we dive into that a little bit more?
Yeah. So here's the cool thing about Ultimate, right, is the dynamics in which you're throwing from. When you take that against something like a quarterback or a pitcher, their arm slot's going to be the same every single time, for the most part, right? Unless you're Patrick Mahomes and you're a freak athlete, you can be 45 degrees out, not planted on the ground, just throw a strike, right? But for Ultimate, you have to play with so many different angles, right? Whether it's a flick down low, the backhand in your regards, if you throw the hammer, whatever it might be, that you have to have that dynamic in the repertoire, right? But if we're talking about the stereotypical throwing of things, right, we always need to understand core stabilization, right, and understanding the concept of intra-abdominal pressure, and then bracing at the microsecond of, let's call it, impact or release. So really with those components, if we can build strength in and around the core with mobility through the mid back, then we're setting ourselves up for having stabilization in the shoulder for the motion. Okay, so again, if we're in the basis of throwing and we have good foundation through the feet, it's one thing. But if we're on the run, or if we're trying to get around someone, throwing off our back foot, or in those, we have to build that foundation from somewhere else, mainly the core.
So it's like having that foundation through the core then kind of allows the shoulder to be more stable. So then it's kind of less at risk in a sense.
Yeah, in a sense, right? Stabilization will always precede mobilization, right? So if we, again, there are freak athletes in the world that can turn this thing on, meaning their core in a split second and not even know it, right? But if we set ourselves up for positioning through the torso and then having our shoulder in a very optimal position as we throw, that in turn is going to have synergistic action of the muscles to allow us to throw without overuse injuries.
Yeah, that makes sense for sure. Where do you feel like that kind of comes from then, that lack of like the stabilization?
There's going to be certain situations that it's just going to happen, right? Again, there's sometimes a lag in our training that allows us to really focus on it. And when we get into a split second reaction, it may or may not happen. We may move too fast. We may be tired, okay? Or we might just have too much load on it, so we're trying to throw too hard, okay? So those are our three culprits when it comes to injury: speed, fatigue, and load, right? So if we're tired and it's towards the end of a match, things might not be firing as optimally as possible, right? If we're moving too quick, things might not be in sync. But if we can train for those things, right? We train for the strength, we train for the endurance in those situations, we have a higher possibility to not have injury when we're in the sport.
Yeah, I've talked a lot about how it's about building capacity. We did an episode a couple weeks ago with a friend of mine where we talked about in the off season, it's really just about building capacity so that in season you can just handle all that stuff. So it sounds kind of like that's what it is. It's like, fatigue is really a factor, or it's relative to the person, right?
Yep.
Somebody that, has more capacity, they're in better shape, that fatigue is going to kind of come on a little bit later. Or just that ability to like handle those type of forces really just come from like capacity and stuff, just overall training. So I guess when you're like with your experience with throwing athletes, like what are some like training principles or like, methods that you've seen that have kind of helped improve those things?
Of course, one we already talked about, intra-abdominal pressure, right, and understanding bracing at the moment of quote unquote impact for that sport. The other big thing, like is foot stabilization. And I like to use the term: have you ever tried to shoot a cannon off a canoe?
It's not going to go well.
It's not going to go well at all, right? So, we have to understand the foot, its placement, solid ground, so then that energy from the ground can then be repurposed accordingly. If we're on wobbly ground, it's just not. We're going to have to make up. We're going to have to make up it somewhere, and usually that goes up the chain somewhere. So really having people understanding foot placement, core, and then the centration of the shoulder, understanding how to call the posterior inferior aspect of that shoulder to where we are in a centrated position of the joint capsule, to where then things are working as optimally as possible.
Could you go into that a little bit more, like the foot stabilization part? So like how might that look with exercises or, in the gym when people are training that?
Yeah. So number one, one of the things that I like to do is shoes aren't going to be on while we're working out, right? We're going to have to understand toe splaying. We're also going to have to understand learning how to grip the ground with our entire foot. So from the toes to the heel, and how we can really start to engage the muscles of the foot, right? This has been a hot topic as of lately, like BOSU exercises are just trash, right? And it doesn't make it harder, but it does help increase some proprioception in unstable ground, right? But with all that being said, it's like, can we unilaterally load the patient to understand balance, coordination, and then add a multiplanar task to the equation, so then we are creating stability through the lower limb that's then translating up into the upper body.
Gotcha. So like kind of single leg stuff or even double leg, but just like without the shoes on, number one, just to get the foot moving.
Yeah, and I would say here's the thing is that like with barefoot, like people there's been instances where like, well, I'll squat with my shoes off all the time. Okay, that's great. Show me. When they show you, they're still not using their foot. So really, like, it's not going to do you any good if you're doing barefoot exercises. You have no idea how to use your foot. We really have to train understanding engagement of the foot, right? So when they come into that, it's like, okay, this is how we use our foot. This is how we position our leg. Okay, this is where we have that hip engaged. Okay, now we can start moving up and start putting these dynamic motions.
What are some things then that you'll give somebody that, like, or I guess, what do you see when somebody isn't able to use their foot well? And like, what kind of stuff might you start to add in?
So what you'll see is just lack of balance. Okay, they're not able to stand on one foot, be it eyes open or eyes closed, right? So you're going to have some coordination issues there. What I like to start with is a couple things. Toe yoga. Okay, so when I talk about toe yoga, that is differentiating extension from isolating only your big toe while your four toes stay on the ground, and then flipping that, plant the big toe, raise the four toes off the ground. And you're going to go through that so then you can start to differentiate extension of the digits. And then from there, we're going to start working on towel pulls. So it's kind of like we have a towel underneath our big toe, right? Our foot's flat, and we're going to start pulling that towel across the ground with our toes, right? So we're starting to engage the foot. Then we start feeling the foot. Then we can get into single leg RDL, right, with a kickstand, making sure that things are rooted. Another really key one for me is that if they're having a problem with the RDL, I'll put a mini band directly underneath the knuckle of the big toe and put resistance on that band while they do the exercise. And the simple cue is, don't let that band go. So then they're forced to really engage the foot, forced to have the forefoot down, and then you're putting them through that exercise.
I like that. I think, like, just based off what you're saying, are you familiar with like the tib raises that are super popular now?
Yeah.
Right. And I made a post about these recently. And
Saw that.
yeah. The idea of like we can isolate certain things, but at the end of the day, we have to get everything to work together, because everything works together when we play sport or do anything. So I like that of like, isolating the foot at first, but then it's like how we've got to get the foot to then work with everybody else as quick as possible. Right?
That's it.
Yeah. So getting the foot to work with the glute, getting the foot to work with everything, like, the upper body, like dynamic part. Yeah. So I think that's really good stuff. For people maybe that are at home, right? They've maybe started to do some barefoot stuff. That's something, I talk about a lot too, is just like getting out of the shoes and doing the warm up barefoot at a minimum, right? If we're always in cleats on grass, like, we've got to have opportunities where we can get out and be barefoot. But yeah, for somebody that's like kind of starting to introduce that stuff, is that stuff that you'd kind of recommend?
Yeah, it's a good introductory, right? It's simple to do, right? You don't need much to do it. We all got towels laying around home, so we can do the toe curls, lifting up the toes, no big deal at all, right? And then it's just really, because, you have to think about, most shoes out there are like leather coffins to the muscles of our foot. We are constrained. So then your transverse arch of your foot is compromised, okay? And once those things get compromised, atrophy will set in, right? And then you're going to see things to get very, very narrow rather than using the entire foot. So to your point, yeah, get out of the coffins. get out of the coffins and start working. I mean, I think some people ask me, they're like, why do you always have your shoes untied? It's like, so I can slip them off really quick when I want to go into barefoot or do an exercise, right? So it's just really important to feel, right? To really feel what our foot is doing and how do we engage the muscles of our foot.
And I think it's important too to mention, like, I think like with anything, it's moderation too. Like, I think barefoot stuff also kind of has a negative connotation just because it's like, I guess 10, 15 years ago, like the barefoot running craze happened, and then everybody started running barefoot all the time, and then it's like everybody got shin splints and plantar fasciitis, right? And it's like, for ultimate players, we play with cleats, so it's not like we have to get good playing barefoot, right? But there's definitely times when we're in the gym, when we're doing other stuff that like we can strengthen up the foot, right? And then still continue to like, train that skill.
Yeah, it'll always, it will translate. I mean, it just like any muscle of the body, right? How do we get bigger biceps? You do bicep exercise. Right? How do we get stronger feet? How do we get faster? You start working out the foot in its natural habitat that then will eventually start to translate.
Yeah, absolutely. I guess moving on then, so you mentioned your history with back pain and like the L5 injury. I think a lot of ultimate players can probably relate as well, right? With any rotation sports, right? That rotation comes from the spine and other parts, but hopefully it's not something where it's too much and then it becomes kind of detrimental, or it's, too much force in the wrong area type of thing. What are some things like specifically with the back that you see in like rotation athletes?
What you will find is actually a decrease in mobility of the mid-back, so in the thoracic spine, okay? They're going to be locked up usually one way or the other, which in turn, when they try to get into that position, that's going to bog down into the musculature of the low back. Okay, so anatomically speaking, you only have 5 to 10 degrees of rotation that happen in the lumbar spine. Okay, primary mover in the lumbar spine is flexion extension, right? But if we are losing ground in our mid back and we can't rotate, the lower back is going to try to help compensate for that through the musculature, and that's when things like when the facet joints start to just bind on one another, and that's when things start to get bogged down and low back pain starts to happen. The other big thing is a decreased hip mobility. Those are the two facets in the sense that it will translate into low back pain. Again, your hips can't work properly, your back's going to try to overcome that. Things are going to get fired up and things are going to become unhappy.
Yeah, so sounds like upper back or thoracic spine area, mid back, like that's got to be the area of the spine where most of the motion comes, and then right below the low back to the hips, like those are the two areas that most of the motion has to come. And then really don't, like, I guess to what you were saying before with like the intra-abdominal pressure and the bracing, it's like we want that low back area to move a little bit, but we don't want it to be the main mover. We want those other areas to be,
especially in rotation, right? Again, the core is and the mid back the low back region are all about stabilizing. If you look at a joint by joint perspective, your hips are the mobilizers and your mid back's the mobilizers. So that's what we want to make sure that we have open to help with stabilizing.
So for the mid back, the thoracic spine, for somebody at home that might be having some like back pain, or I guess for either, right, for the mid back or for the hips, somebody at home that has back pain from throwing or just in general, are there some ways that maybe they can kind of test that out at home to know if something's the culprit?
Sure. Yeah. I mean, with mid back, it's can you keep your feet together, big toes touching, heels touching, and then just look at the wall behind you one way to the right and to the left. You're going to feel a discrepancy one way or the other, and you're also going to evaluate, is that bothering my low back, right? So that's a pretty quick down and dirty mid back rotational screen, right? And then in the hips, where is your range of motion when you're laying down? Can you pull them up into your chest? Can you pull them up outside of your chest? Is there tightness there? Do you feel like there's a limited range of motion? Can you put your foot on top of your knee and let your opposite knee drop down to the table? do that both sides, understand that from each side, compare. Does one hurt more than the other? And then we start figuring out, okay, do we need to increase mobility into that region?
I guess just sticking with this then, for like, are these things too where you would try to, I guess, kind of integrate them together in a sense, like pretty quickly when working with somebody?
Yeah. Yeah, absolutely. Again, like for me and how I practice, it's looking at the entire picture, right? We're going head to toe. We're understanding what's happening. I've more times than I've had post-surgical back fusion people come in and be like, my back hurts. And you're like, okay. You go through the screen, and I'll never forget this. I said, okay, look, I was like, your right hip has little to no internal rotation. I was like, in your left foot. He was like, what do you mean about my left foot? I was like, your left foot has no stability. You can't even stand for 1 second on that left foot. So we're going to start building that in, right? So we really have to look at all the components to understand what is a contributing factor to why the back is not happy.
Totally. Yeah. I guess best way is always, find a professional, get assessed, get some answers. But for people that are, again, just trying to improve more at home on their own, I've talked about a lot of these topics, like, improving thoracic mobility, improving hip mobility. And I think when people hear that term, improving mobility, we go right to stretching, right? It's like, oh no, but I can touch my toes. Like, I do yoga all the time. Like, my mobility is really good, and I still have back pain, right?
Right.
Like, I guess just starting with maybe that concept of like mobility, then is there maybe something that they're not doing right in a sense?
Yeah. So that's a fair point. Let me just say that the other caveat to back pain is that it could be a lack of stabilization, right? And it could just simply be a shearing, unstable environment of the low back, right? Okay, so then how do we strengthen the structures around it, right? How do we introduce these stabilizing strategies, be it through anti-rotation of the low back and whatever else? So caveat to that is, you can be unstable, right? And for yogis and people that are out there, like you can be doing these things and not gaining strength in those structures. So you have to always have the component of building stability and strength, especially in the low back.
Yeah, for sure. In one of my earlier episodes, I talked about how things in Ultimate and things in life in general, it's not binary, right? It's not 0 or 1, yes or no, black or white. I think a lot of people in the Ultimate space, I think, at least I know a lot of like software engineers, computer science people.
Yeah.
Where I feel like that field is very black or white, right?
Mm-hmm.
But then we look at Ultimate, and it's like, is a squat or a deadlift better for Ultimate? And it's like, well, it depends. Who are we talking about, right? And this, I think, is another beautiful example of that. It's like, why does my back hurt? It's like, there's billions of different things that could be going on.
Yep.
Right? And it's like, oh, well, Justin, you said improve your hip mobility. And it's like, okay, well, maybe it was a stability issue for you. Or it's like, oh, you said improve stability. It's like, maybe you needed mobility, right?
Yep.
I think it just kind of further shows, like, you've got to do some digging. If you want to seek out a professional that can help you with that digging, like, that's always a good option too. But yeah, I think it's just like this conversation so far has just shown there's just like so many factors that lead to an injury, right?
Yeah, absolutely. And again, like another interesting thing that comes into play, especially from a shoulder perspective, and there's been research done on this, is that, again, if we talk about shoulder problems, right, especially in Ultimate and throwing athletes, research done, I think about 10 years ago, that showed that about just under 48% of people with shoulder pain had a dysfunction of the thoracic spine. Okay. And about 45 or 46% of shoulder cases actually had a dysfunction in the neck. Okay. So I don't want us to exclude the neck either, right? Because, if we are limiting mobility or range of motion in our neck, that can correlate into shoulder pain because the shoulder is trying to overcome a lack of motion in the neck. You're going to work harder. You're going to have muscles bogged down in the neck that are ultimately connected to the shoulder, and things are going to start to show up as shoulder pain. When in reality, to the statistics that I said, can be a dysfunction from either the mid-back, thoracic, or the cervical spine.
Kind of goes along with that idea that like the site of the pain is often not the culprit. It's just the victim.
As they say, if you are treating the site of pain, you are lost.
Yeah. Everybody's looking for that stretch or that one exercise right for their spot.
Right. Right.
Yeah, I guess so since we've kind of touched on a lot of the different like localized areas that might be contributing to, just dysfunction that you see in throwing athletes, are there any good drills or exercises that you like that really tie like everything together to really work on like proper throwing mechanics?
Yeah, I mean, again, like with Ultimate, it's so different in the sense of arm slots can change literally throw to throw, right? But what I will say is that, again, making sure we have good rotation in the mid-back, one. Two, then understanding scapular function, so your shoulder blade, and making sure that it's positioned properly before we go through exercises, be it wall slides, rotator cuff exercises, whatever. If we put ourselves in a poor position for those, things are going to get worse. So the big thing for me is understanding, do we have posterior chain components being recalled, being strengthened, being developed to where we can start to continually progress into the throwing motion.
And for those that don't know, like what could you explain the posterior chain?
Yeah, so posterior chain simply is just all the muscles about our back, right? So all the way from the back of our neck all the way down to our heels. What I always like to tell my patients is that we are gravity fighting society, right? We are forward flexed looking at our phones. We're forward flexed looking at our computers. We're forward flexed, just sitting there sometimes, right? We're whatever we're doing. So we're always constantly fighting this anterior gravity component when we ultimately are made to be upright, looking up at nature and into the sky. So that is a big thing for us, that we should really be focused on developing the posterior side or the back side of our body to help offset that.
Something else I've seen from working with like a lot of ultimate players now is they're very like forefoot dominant, right? Because that's where we need to be when we're sprinting, we're jumping, we're cutting, right? But then a lot of times it's like we live there and don't have that ability to also get back. So then, like you're saying, like posterior chain gets weak, like they can't use the glutes. Hamstrings end up just being these like stretched out rubber bands, right? And then you get the hamstring strains when people are running. So big goal for me has always been like trying to get people back a little bit, be able to access their heel, access their glutes, access their hamstrings. But it sounds like that's also a huge thing to help out with like just overall injury prevention.
Yeah, I mean, absolutely. And injury or even just posture, right? I mean, we're stuck at computers most of the day and sitting down most of the day. So it's always good for us to be upright and being drawn back.
Cool. I guess shifting gears here a little bit, in the strength and conditioning world, I think there's a lot of things that people do to train rotation, right? So like the med ball throws are kind of a big one. Are there any like kind of big modalities or like types of exercises that you like in strength and conditioning? Maybe ones that you don't like as much?
Yeah, I mean, there's thousands of ways to skin a cat, right? But in the throwing capacity, right, it's multiplanar, right? So it's sagittal, right? It's frontal, right? And then there's the theta component of it, that is rotation. So when you're going into those complex movements, it's important that you go into the multiplanar facet and do so with stability and control. The most important thing is that your body's only going to move as fast as it knows it can slow down, right? So if you are able to do things very, very controlled, that in turn will actually help you with speed, because your body knows you can control the stuff.
Interesting. Yeah, I guess I never thought about that. That's something I've kind of like played around with, like with throwing, like seeing if I can get out into like my step out for my backhand as slow as possible. Because it's like if I can do it super slow, then I know when it's go time, I can get to that spot.
Bingo.
But yeah, that's interesting. I guess applying that more to different exercises would be cool.
Yeah. And you know, working with professional athletes is really eye-opening too. You know, I've had the fortunate to be in the locker rooms of professional organizations and work with some, you know, professional guys, and to watch them go through even rehab exercises. It is so intentful. You don't have to tell them to slow down. They are going to be slow. They're going to groove it perfectly. You're not going to cue them. They're just going to do it. And that's what I talk about, like these savants out there, that it's fascinating to watch because they're going to do it. They're going to do it well, and they're going to do it as slow as stinking possible.
It's the foundation of body control, right?
So,
Yeah. Interesting. In my mind, it's almost like a chicken or the egg situation then. It's like, did they develop that level of awareness and that level of intent from like doing it really fast, maybe without thinking, like as they developed? But are you saying you think it's more the opposite? Like they were very intentful and then that kind of helps them?
yeah, I think it, you know, if I had to bet, I would say it's the latter. I would say that, you know, again, like professional athletes, they're freaks of natures. They really are. And it's so amazing to watch them. You know, and they just have like this different level. They zone in. I mean, they just turn it on. You give them a cue one time, and they'll show it to you perfectly, and you're like, I'll be dang, there it is. So I really think it is the latter, where it's just that they are intentful in what they're doing and how they do it.
Working with more and more ultimate players too, it's just, yeah, it's fascinating to see like the correlation between like the level that somebody plays and how good they are at basic exercises. It's like, you know, somebody that maybe doesn't play as high of a level, it's like, all right, let's start with just learning how to skip. Right. But then with somebody that's coming from like, you know, the AUDL, like the pro league or like elite level club or something like that, it's like, I'll give them, you know, some of that stuff initially just to kind of see where they're at. And it's like mastered. And it's like, all right, we've got to really got to increase the difficulty.
Yeah. We got to find something harder for you to do.
Yeah. Or else it's useless. Right.
Yeah, exactly.
Just go play ultimate and you'll get all the stuff
exactly.
you already need.
Yeah.
And then I guess shifting gears one last time, just because we're also kind of coming up on time to start to wrap it up. You know more about ultimate than I expected when you were talking about the flicks and the hammers.
Do you like that?
And stuff. Yeah, that was impressive. I guess from your experience, like watching ultimate and stuff, like, do you have any advice for players? I guess outside of, you know, the stuff that we talked about. Like, are there any maybe patterns or things that you see that you feel like you have some training or exercises or like principles that might help out?
You know, I mean, like I said before, like with the dynamics of the throwing motion, I translate that towards a middle infielder of baseball, whether they have to turn two, they have to in the hole, and they're going to have to throw it down low, right? They're on the run on a slow rolling ball, and they're flicking it over to first. So like for me, right, like that is. Can you look at that and understand, like, how can that translate? How can I get into those positions and kind of take cues from a middle infielder or an infielder for that matter to understand arm slots and how they're positioning themselves with their body to get to that angle? You know, that's the biggest thing, especially from that. I mean, but then there's also other facets of the running, the jumping, and whatnot of just agility, right? And just having those fast twitch muscles, you know, ready to go, and having reactionary components into your training to where you're just calling it quickly. You know, and the last thing is, man, just training is training, and then once you get on it, just let it go and have fun. Just turn it on and let it go.
Yeah, that's awesome. Awesome. Cool. Well, yeah. How can people find you? And if they can't come out to Bee Cave, Texas, any advice for finding a good sports chiropractor like yourself?
Yeah. So Kinetix Sport and Spine. So it is Kinetix 8. So that's KINETIX ATX.com. Same handle for Instagram, Facebook, and all those. Like Justin said, this is month 2 of opening, so the content is few right now, but slowly getting over the hump of not putting out content. So I'm going to be ramping that up here soon. I always am biased in the sense of, because I have been active release technique certified for it was for about 4 years, and then I'm working to get recertified. So technically, I'm not claiming myself as a certified active release techniques provider, just so Dr. Leahy is okay with this. But
gotta be careful.
Yeah, trust me. But I'm biased in the sense of that treatment, because if somebody is in the active release techniques directory, usually they have the same approach that I take in evaluating patients and injury. So you can go to activerelease.com, and they actually have a directory there that you can put in your zip code, and you can find a couple different providers. Now, with that being said, massage therapists are ART providers, physical therapists are ART providers, chiropractors are ART providers. So, it all depends on what you're wanting to get out of it. Again, there's someone for anyone out there that needs help, right? Some people are just going to go to orthopedic route. If that's their thing, that's their thing. Great. If you're wanting the more quote unquote conservative manual therapy aspect, then, look at, physical therapy or chiropractor, even massage. Massage is great, for people. So, that just comes down to personal preference as it relates to the patient, and giving them the freedom of choosing what's best for them. But I would say that that's the best way, just to kind of get an understanding of who's out there from a soft tissue perspective. Because again, if they're treating the soft tissue, then they're looking at the body completely different.
Yeah, and then just to add to that, I think the eye test is really important. Like your clinic, your gym is about 3 times the size of the treatment room. So I think if you go into a chiropractic clinic and it's no gym, no exercise equipment or anything, that's probably a good sign that they're not going to teach you exercise or movement or anything.
Yeah, and that's a very fair point. There's, and I will say there's another one. There are gym clinic hybrids out there that are really pushing you to get into functional movement as quickly as possible. There's docs out there. I trained underneath one of them when I was in school. That you can rid of pain by loading a patient. Don't be afraid to load your patient when they're in pain. You just have to do it properly. You have to understand where they're having a fault. Can you recreate the positioning and really getting people to move? It's just, again, it's the way I like to go about it with patients, and see really good results with it. If somebody's only seen me a couple times and they come back and they're like, I'm great, awesome, right? I don't want you to be dependent on me. I don't want you to be here if you don't need to be here. I fully believe that we as practitioners should be giving our patients the tools necessary outside of the clinic walls to where they can excel and prosper outside the clinic walls. That's life. You don't need to be dependent on these providers. We're here. We can help. But we also should be giving you the tools to excel out in the real world.
Right on. Yeah, wish more providers thought like that, but I think it's definitely a good philosophy.
Well, that's business. For unfortunately, sure. If we want to just strip it down, it's a business thing.
It is what it is. But yeah, right on. Cool. Dr. C, thank you very much for your time.
Thanks, buddy. Thanks for having me.
You've been listening to the Tobu Fitness Podcast. We hope you've enjoyed the show. If you did, make sure to like, rate, and review. We'll be back soon. But in the meantime, hit us up on Instagram and YouTube at Tobu Fitness. And to get info on one-on-one coaching and training programs, hit the website at tobufitness.com. Thanks so much for listening, and see you next time on the Tobu Fitness Podcast.